Welcome to the bonus module. We will talk about additional treatment options to overcoming ED. We will cover the following topics: the next level of options if the holistic and natural approach does not work, which is including non-invasive treatments, PDE5 inhibitor medications, shockwave therapy, and also invasive treatments, which are penis injections, platelet-rich plasma injections, and penile implants. Now, all these treatments do require physician consultation to initiate. We will first talk about one of the most popular non-invasive therapies. In a previous module, we had mentioned about phosphodiesterase type 5, or PDE5. Now, PDE5 is an enzyme that is present in the walls of blood vessels, including those in the penis. Its primary role is to regulate blood flow by breaking down cyclic guanosine monophosphate, or cGMP, a molecule that promotes blood vessel dilation. When sexual arousal diminishes, PDE5 becomes active and breaks down cGMP, causing the arteries in the penis to constrict and blood to flow out, resulting in the loss of an erection. So basically, PDE5 starts the process to make the penis flaccid again. PDE5 inhibitors are medications that work by blocking the action of PDE5. By inhibiting PDE5, these medications prevent the breakdown of cGMP, allowing it to accumulate and maintain the relaxation and dilation of blood vessels in the penis. This increased blood flow helps to sustain an erection during sexual activity. So PDE5 inhibitors help keep erections erect. Some commonly known PDE5 inhibitors include Viagra, Cialis, Levitra, Staxin, and Stendra. These medications are prescribed to individuals with ED to assist in achieving and maintaining erections. However, it's important to note that these medications require a prescription and should be used under the guidance of a healthcare professional. I want to talk about the most popular PDE5 inhibitors. Viagra. Viagra usually takes about 30 to 60 minutes for it to start working after ingestion. The effects can last for approximately 4 hours. Viagra is taken on an as-needed basis, usually before sexual activity. Cialis. Cialis takes a longer time to start working compared to Viagra, usually about 2 hours. However, its effects can last much longer, up to 36 hours. Now, Cialis can be taken daily at a lower dose for continuous treatment of ED. Levitra and Staxin. Now, Levitra typically takes about 30 minutes to start working, while Staxin, the orally dissolving form, dissolves on the tongue and may work faster. The effects of Levitra and Staxin last about 6 hours, and they are taken on an as-needed basis before sexual activity. Stendra. Stendra usually takes 15 to 30 minutes to start working, making it one of the fastest-acting PDE5 inhibitors. It has a duration of action of approximately 6 hours and is taken before sexual activity. Some common side effects of PDE5 inhibitors include headache, indigestion, nasal congestion, altered vision, and palpitations. Now, these side effects are usually mild and temporary. Now, PDE5 inhibitors should not be taken by individuals who are already using nitroglycerin or alpha blockers, which are commonly prescribed for certain heart medications. The PDE5 inhibitors can interact with these medications and cause potentially dangerous drops in blood pressure. Additionally, individuals with specific heart conditions or those at high risk for cardiovascular disease should exercise caution when using PDE5 inhibitors, as they can have an impact on cardiovascular function. Therefore, it is essential to have a thorough discussion with a healthcare provider to evaluate the potential risks and benefits of PDE5 inhibitors and determine if they are suitable for one's specific situation. Low-intensity shockwave therapy is a non-invasive treatment option for ED. It involves using a device to deliver low-intensity pulses or shock waves to the penis. The shock waves help stimulate the growth of new blood vessels and improve blood flow to the penile tissues, which can result in improved erectile function. Now, this procedure is a painless procedure that typically takes about 15 minutes per session. It is usually recommended to undergo around 6 treatment sessions. Now, the effects of shockwave can be long-lasting, with successful results lasting for 1 to 2 years. It is important to note that this therapy should be performed by trained professionals who have expertise in administering this treatment. While the procedure itself is generally safe, it may not be suitable for everyone with ED. It's essential to consult with a healthcare provider or specialist to determine if this therapy is an appropriate option for one's specific condition and medical history. Now, one factor to consider is the cost of this therapy, as it is typically not covered by insurance. Now, let's talk about invasive treatment options for ED. Penis injections, also known as intracavernosal injections, are a treatment option for ED when other non-invasive treatments have been not successful. Now, these injections are self-administered at home before sexual activity. To perform the injection, a very thin needle is used to inject medication into the side of the penis. It works by increasing blood flow to the penis and facilitating an erection. After the injection, it typically takes about 5 to 15 minutes to achieve an erection. The erection should last between 30 minutes to 2 hours, providing an opportunity for sexual activity. The most commonly used medication is prostaglandin E1 or PGE1, also known as alprostadil. Other medications that may be used include papaverine and phentolamine. In some cases, a combination of these medications known as bimix, trimix, or quadmix may be prescribed. It is important to follow the instructions provided by a healthcare professional when administering these injections. Platelet-rich plasma, or PRP treatments, have been utilized in various medical fields, including the treatment of injuries to muscles, tendons, joints, and tissues. And now, PRP treatment is becoming popular for the treatment of ED. Now, platelets contain growth factors that aid in the healing process and promote the growth of new tissue. In the context of ED, PRP treatments have been used in a procedure known as the Priapus shot or P-shot. During the PRP treatment, a small amount of blood is drawn from the individual and placed in a centrifuge. The centrifuge spins the blood, separating the platelets from the rest of the sample. The concentrated platelets, rich in growth factors, are then injected back into the penis. The purpose of injecting platelets into the penis is to stimulate the growth of new tissue and promote the recovery of healthy erections. The idea is that the growth factors released by the platelets can enhance the overall function and health of the penile tissues, potentially improving erectile function. It is important to note that PRP treatments for ED are still considered experimental and have not been widely accepted as a standard treatment. The effectiveness and safety of this approach are still being evaluated through ongoing research. Additionally, PRP treatments for ED can be costly, and insurance coverage is typically not available since it is considered an experimental treatment. Individuals interested in PRP treatments for ED should consult with a healthcare professional who specializes in sexual medicine to discuss the potential benefits, risks, and alternatives. Penile implants are surgically implanted devices that are considered a last resort for the treatment of ED when other methods have been unsuccessful. There are two main types of penile implants: semi-rigid rods and inflatable implants. Semi-rigid rods are made of metal coated with silicone. They are firm in design yet flexible, allowing the penis to be bent upwards for sexual activity or downwards for comfort and concealment. The rods are implanted within the erectile chambers of the penis and provide a constant firmness, allowing for penetration and intercourse. While they do not offer ability to achieve a completely flaccid state, many find them to be a satisfactory solution. Inflatable implants consist of two flexible cylinders that are surgically placed within the penis. These cylinders can be filled with sterile water using a pump that is implanted in the scrotum. A reservoir which holds the sterile water is placed either in the abdomen or the scrotum. By activating the pump, the cylinders fill with water, creating an erection. To return the penis to a flaccid state, the valves are released, allowing the water to drain back into the reservoir. Penile implants have a high satisfaction rate among those who have undergone the procedure. They provide a reliable and predictable method of achieving and maintaining an erection for sexual intercourse. However, it's important to note that, like any surgical procedure, penile implants carry risks including infection, mechanical failure, and changes in sensation. Before considering penile implants, it is crucial for individuals to have a thorough evaluation and discussion with a healthcare professional specializing in sexual medicine. In summary, when holistic measures or first-line treatments are not effective in managing ED, healthcare providers may recommend non-invasive or invasive treatments. Non-invasive treatments include the use of PDE5 inhibitor medications such as Viagra, Cialis, Levitra, Staxin, and Stendra. Shockwave therapy, also known as low-intensity shockwave therapy, is another non-invasive treatment option. Invasive treatments are typically considered when other treatments have failed or are not suitable. They include penis injections, PRP injections, and penile implants. It's important to consult with a healthcare professional who specializes in sexual medicine to discuss the various treatment options, their risks and benefits, and determine the most suitable approach based on individual circumstances and preferences. You have completed this course. Congratulations! I hope the materials presented have been valuable information to you. I wish you the very best in overcoming and managing your ED. Have a happy, healthy, and enjoyable sex life.